Hello, everyone, and welcome back to The Advisor. I am Lisa Urbanski, co host of the show. And today is going to be another truth telling episode with Lidia Molinara. We are going to tear back the curtain on healthcare and reveal what is really going on. So, from burned out staff to tech breakdowns, rushed care, and top down policies that miss the mark, Lydia breaks down the most common and dangerous medical errors, the misdiagnoses, the medical mix-ups, the missed follow-ups, and the role we all play in preventing them. With medical errors now the third leading cause of death in the US, this is more than just a conversation. This is a call to action. So stay tuned to get the facts, the truth, and the tools you need to speak up, stay sharp, and take control of your care. So Lidia Molinara is a pharmacist, a certified geriatric practitioner, and a patient safety officer. She is also the founder of Mom's Healthcare Navigator. She lives in Kelowna, British Columbia, Canada. And Lydia has a podcast on her channel called Medi Mastery, Empowering Health Advocates. And if you have not checked out her latest episode, her and I dove into what health advocacy actually is. So you might want to go check that out before you listen to today's or listen to today's and go check that one out because there was a lot of valuable information there. Before we get started, I just want to thank our sponsors, Spreaker and iHeartRadio. Thank you so much. Without you, this would not be possible. Welcome back, Lydia.
Thank you. Thanks again. This is going to be a fun topic.
Yes, and such an important one.
Exactly. I mean, when I'm listening to you, of course, I'm nodding my head because I think we really need to get this message out. And it's not about being untrusting or fearful. It's more about what you said, the call to action on how we all can play a part in making sure we stay safe when we navigate healthcare and when we get to go to have to access healthcare. What's the best strategies in order for us to get the optimal care? That's ultimately what we're trying to accomplish.
Beautiful. Do you want to remind the audience who you are? And then we'll get into the behind the scenes stuff.
Well, I have been practicing as a pharmacist, like you said, for over 30 years. I owned and operated. I started very young when I started working at a pharmacy at 17 and basically being the cash register at the pharmacy. And I remember people coming up to me asking for medications and having no idea what they were asking for. And that led me to a path of really getting down to what is it that I wanted to accomplish in my life, and helping people was my number one goal. And it was that passion that really propelled my entire career. I then owned and operated pharmacies and always looked at ways to make sure we weren't making errors, and how to support my staff and how to provide programs so that when we were giving medications or giving policies for assisted living facilities, how were they going to manage medications? And we did so much work in that area. And then, of course, that led me to becoming a certified patient safety officer, where basically I learned the tools, the tricks, and understood the whole world of errors in healthcare and how to prevent those, not just as a healthcare professional, but also as a patient, and the whole concept and notion of active participation. And as a mom myself, I realized that the most vulnerable community in a lot of ways is caregivers, and moms being a huge part of being caregivers, because we have I would say, the utmost internal, mama bear, almost like really want to make sure to protect our children. And when they're sick and when they're not feeling well and we don't have answers, or we are trying to seek answers, that's when the frustration and the stress really comes in. So I wanted to provide this knowledge and awareness so that all moms can feel like they can navigate the situation. And that's ultimately the goal that I'm trying to accomplish.
It's beautiful. And there's so many people that are struggling with the healthcare system. It's not even struggling, it's the unknown. I love how you're educating everybody, giving people the information that they need in order to be empowered to advocate for themselves and their families. So let's get into it, the common healthcare errors and missteps. So where do you want to start?
Well, I think we'll look at behind the scenes so that we understand why this is a concern. Healthcare has changed tremendously, even from when I started 30 years ago to today. We have over 20,000 prescription medications on the shelf. That is the highest it's ever been, and there's so many treatments. And there's so much technology, and there's so many herbal products and supplements, and home remedies that are being touted right now. So when you add all of that, you might think, yeah, but the technology is great. We've advanced so much. The issue is that technology can break down too. So when you add a system where we have information overload, we have few staff, we have probably, I think the estimates now worldwide is that we're going to have the most amount of basically job vacancies in healthcare as ever before. So there's a shortage of staff. So that means overworked staff because somebody's got to be able to do it when you're there. You have the whole notion of, and I hate to say it, but post-COVID, where you have a lot of people that got burnt out and left the entire healthcare community. You have that situation that added to it. And you have the issues of, like you said, policies that are sometimes written by people who aren't on the front lines. And what do I mean by that? There's people that are literally not practicing, that are trying to put policies in place on how to practice. And they don't understand the intricacies of those different situations or how that policy will lead to an error. And then we have the whole thing of human error, which happens with the most brilliant. No matter how trained, you can make a mistake. And sometimes those mistakes take 1 second. You inject the wrong drug, you inject it the wrong way, that creates an error, right? So, and we're not talking about all life-threatening errors, but it creates an error where now the healthcare experience has taken another path, which is not optimal. So we have a system that we can say is not ideal, and it never will be ideal. I don't think we can ever get a healthcare system that is free of error. But what we can do is understand that when you go in to a healthcare provider or to a system within the healthcare system, that you understand there's a potential for error. And that's how you have to set your mindset. I am here to be the defender of my family when I access healthcare, including my own. And I think if you have that mentality, you walk away from the experience in a whole different level of confidence because now you feel like you can make a difference and you have a say in the healthcare. And that's where we start. We have to start with recognizing that the healthcare environments are not 100% foul proof. Errors can happen. When you have that mindset, then you got to look at the different areas of accessing healthcare. And I'm sure that you'd have a story that you could share as well about what happened in healthcare one time. I'm positive, like in the pharmacy, there's stories about picking up the medication and being like, this doesn't seem right. You see these all over in social media. And that's what I mean by healthcare errors.
I was very over medicated at one point, and it was just like a misunderstanding, miscommunication, and I didn't know. I was very young, and I kept taking the recommended dose on my, prescription bottle, and I just felt so weird and bizarre, and didn't really put two and two together. But you're right. Everyone has stories, and I love that you're, advocating for us and educating us. So why don't we get into some of the patient-inflicted errors?
So I think for patients, we look at the healthcare system and we think, well, it's them doing it. They're making the errors. But a lot of times the errors are because as patients, we don't communicate the right information, or we don't follow things the right way, or we don't express our concerns when they happen when we should be. So if we look at, medications is probably the number one area where errors occur because it's the number one therapy provided. We
Hmm.
medicate with medications. So that's usually how we treat our issues, our symptoms, our chronic diseases. It's through medication. And that's a reality. I'm not saying it's right, it's just what we do in our Western culture of healthcare. So when we look at medications, we have to take into consideration that us as patients, when we don't follow the dose, so we're going to take two instead of one. That's a problem because that could lead to an error. We're not going to understand the drug interactions with that medication. So now we're taking, something as simple as calcium with a thyroid medication, and they're going to bind, or calcium and iron, and they're going to bind. You're not going to get the drug that's going to be as effective. And the
What do you
one that I
mean by
think
that? So they bind and cancel
bind
each other
together.
out?
And then it's, yeah, they cancel each other out and away it goes. So you're not getting the benefit of taking a calcium tablet and you're not getting the benefit of the other medication. So you have less effect. And then, you might have to be increasing the dose. You don't need to increase the dose. You just need it to take it the right way.
I'll
So
take the cal. Yeah.
right? So, and that's what happens. We'll go back to the doctor and say, this isn't working. And then the
Yeah.
doctor
Yeah.
says, okay, let's increase it without asking, are you taking a multivitamin with it?
Oh,
So something as simple as that, understanding the dose, understanding drug interactions. There's also something called drug food interactions. So you shouldn't be taking milk, which has calcium, with your tablets per se. You shouldn't be using caffeine with certain antibiotics because they can boost the caffeine. You're not sleeping at night and you're not feeling well then. So sometimes we don't understand drug food interactions and they create a problem. And then when you look at just adherence, what we call adherence is basically meaning taking the medication at the correct time and using it the right way. So in other words, if it's scheduled to be every day, a half an hour before you eat, you need to take it a half an hour before you eat because some of those medications won't work if you take them with food. The acid, when you take food, will basically not allow the drug to be properly going through your body. So then that's another issue with medications that we see and measuring them. With moms, we have to measure medications for our children, and often it's in liquid form, and we don't understand how much we have to measure per se. So understand those simple tools because that's where overdoses can happen. And one of the other really critical ones that we see from an over-the-counter medication, and we see children in hospitals because of this, is our acetaminophen, our Tylenol. Tylenol is in a lot of products. And when we double up on that, there's overdose situations that can cause significant damage to the liver and can even cause death. So I always warn moms when they're buying Tylenol to make sure that they don't have something at home, like a cough and cold medication, that now is going to interact or double up the dose. So really making sure that you are taking your medications correctly and making sure that you're following the right rules. So how do you protect yourself in that way? You need to ask those questions. You need to have that in because medications is an issue. When we look at going into a pharmacy, I talked about this many times. When you walk into a pharmacy, you should already know what the doctor has prescribed for you. What's the name of the medication? What's the dose? How many times a day do you need to take it? Because sometimes the doctors will, and this happens, I've been a pharmacist where I have the conversation with the patient and say, oh, this medication is to treat, swelling. You must have an issue. And they're like, no, I have a stomach problem. Well, Lasix and Losec, when they're written, look very similar.
right.
Fortunately, we, come along and we understand now that we can ask those questions of patients and they have the information. And that's huge. That is how you can prevent an error. Understanding that what the doctor wrote and what the pharmacy is giving you matches. Really important. And then asking the pharmacist those questions. What is this medication for? How is it going to affect me? What are the side effects that I should be aware of? Which ones will go away? Which ones do I need to see the doctor about or stop the medication? And how do I manage the side effects? What other medications can't I take with this? What other food products? And when you have that, those are 8 questions. Write them down, do it every single time because that's really important. And the other thing is when you go refill a prescription. You go in, you're refilling a prescription. Don't leave the pharmacy until you open the bottle or you open the pills and check to make sure they look the same because there's shortages and sometimes we have to substitute one drug company from another and it won't look the same and you want to make sure that that is the correct product. And I'll tell you an example of what happened to one dad when he went and picked up medication for his son. He said to the pharmacist, "This doesn't look right." And the pharmacist said, "Oh no, it's correct. It's just another manufacturer." Went home, gave it to the boy, and then ended up in hospital because it was not the right drug. So how now do you protect yourself, right? Well, I asked the pharmacist. I did my due diligence. That's when I say always look at the image of the medication. Google the name of the drug, click on images, and you will see if it's correct. So that encompasses pharmacy errors in a nutshell. When you look at going to a hospital and someone's giving you medications, you have to do the same thing. When you have the treatment plan, what is the name of the medication? How many times a day is it going to be given? And what do you need to watch for? Can this make me drowsy? Can this make me have a fall? Because falls in hospitals is a huge concern. And of course, when you think about it, if you've just had surgery, you're going to have a lot of medications for pain. And pain medications can make you dizzy, can make you drowsy, and it can be at risk of fall. So that's a side effect of a medication that can then create what I would say a not optimal health outcome. So that's where you want to make sure that you understand what medication you're getting and its side effects, even though you're in the hospital, because those side effects are important to understand. And I know that sometimes when you're in the hospital, you're not well. So that's why having an advocate there for you is really important too. Bring a friend. I always say bring a friend. That's another measure of preventing errors because they can be an extra set of eyes and ears. So with medications, when you're being administered it, when the nurse comes in to give you a medication, you just want to pause and say, "Oh, is this for me?" As a patient identifier, is this for me, Lidia Molinara? My date of birth is this. Is this for me? Yes. They'll
Right.
answer yes, but that's a double check for them, right? Being rushed. I've got three, four patients in a room, potentially. I'm walking in, I've got three different medications on the cart. Who am I giving it to, right? So you want to pause and just say, is that for me? They say yes, great. You've patient identified yourself. Second is, what medication am I getting? And they should be explaining what medication you're getting. And you should have a sense of, yes, that is the medication I'm supposed to get. And I was in a situation where I went as an advocate and they were hanging a bag that was going to go IV. And I said, "What medication is that?" And they gave me the name, and the nurse told me. And I said, "No, that was discontinued yesterday. We were going to be starting this new antibiotic today." And the nurse went, "Oh, let me go back and check the chart." Comes back and says, "Oh, yeah, you're right. That's not the medication for,"
Wow.
right? Because it was discontinued, but the new order didn't get put in, even though it was written. So this
Right.
is why you have to check to make sure that the medication that you're getting is correct. And, I know also of women who are 80 years old getting medication who will say that doesn't look right to me. And that's what you want to say if something doesn't look right. That doesn't look right to me. Yesterday it was this, or am I mistaken? Did the dose increase? You need to know these things because that helps.
Right.
And when you're dealing with children and you're a mom advocating, I would always ask that question. Is that correct? If it's the first time a medication is being given, you want to know what's the dose? How is this normally given? Because if it's, 50 milligrams per kilogram, you want to just do a quick calculation. If your child weighs 20 kilograms, you multiply it, you get the dose, and you confirm that. I know it sounds like, well, I'm not a pharmacist. I didn't go to school to do this. I get that, but this is almost critical to make sure that medication errors don't happen. And it's an extra little step. And I say now we have so much technology around us, you can just put it into your phone
Mhm.
and calculate based on weight, and it will spit out the correct amount. And if you find an error, what do you do? When you find an error, you're calm, confidently calm, I would say, and you just say, "You know what? I'm not understanding. If it's supposed to be 50 milligrams per kilogram and they weigh 20 kilograms, how did you get a dose of 800 milligrams? I'm not
Right.
getting that. I don't understand that. Can you just walk me through that, please?" There's nothing wrong with saying that. I, as a pharmacist, when I was giving, you know, it was a vaccine clinic and I was giving vaccines. And the patient said to me, "Oh, I have an allergy to latex." I thought, great, got it. Latex-free glove, no problem, gave the injection, went to put on the Band-Aid. And he says again to me, "Does the Band-Aid have latex?" And
Hmm.
I was like, oh gosh, I don't know. I didn't consider it because I
Right.
have a lineup of people. I'm rushed. And I was like, wow, thank you for saying that. Healthcare professionals who are truly invested in not making mistakes and there for your care, they will pause with you. It's not going to be combative, it's going to be collaborative. We're going to work together.
Mm,
Because when he said that to me, I was so relieved because I don't want to make a mistake.
yeah.
Nobody wants to go home and make a mistake, right? So it's really important to have that collaboration. And that's how you can protect yourself in those two incidences when it comes to medication.
I have an interesting question. So as you're speaking, as a pharmacist, if you get a prescription from someone that you feel like something's off, or maybe it's like you know the patient, do you take the initiative to call the doctor, or how does that work in that situation?
Absolutely. I can't tell you how, maybe that's why I talk about advocacy so much because I did it every single day and multiple times in a shift. Yes, we absolutely do. In the situation where I say, oh, this medication is going to be for, swelling, and someone says, no, it's for my stomach,
Right.
automatically I'll ask more questions, get on the phone with the doctor's office and say, look, I just had a conversation with the patient. They seem to feel that this medication is not for this. Is there any concerns here that I should be aware of? Can I re-educate the patient on your discussion? And oftentimes we will be told, oh, yes, it's this versus that. When we
Mm,
see medications that have a higher dose, right? When I was talking about 50 milligrams per kilogram and it's dosed higher, we will call and ask, why is this higher? And again, it could just be something as simple as I clicked the wrong button because a lot of the medical record systems, they're automatic. You pick the name of the drug, you put the weight, and they do it automatically. If someone put
right.
it in pounds versus kilograms, that will calculate a different dose. So it's just as simple as that, that a mistake can happen. So it's really important that that communication between pharmacy and physician happens all the time. And we are advocating on behalf of our patients. But it is also the responsibility of the patient to be actively engaged. And that's what's going to help the pharmacist, help the physician diagnose, help the pharmacist make sure you have the right medications, help the nurse make sure you're getting the right drug as well. So, active participation doesn't mean you have to know everything that we know. It means that you understand your plan and everything is following the plan.
Right, right. Yeah, that makes a lot of sense. And man, as a pharmacist, you're get to know the doctors real well, I imagine.
Well, we do, and sometimes we chuckle behind the scenes because when we, see a physician's prescription, we can't read it. We're all in the back going, "What does this say?"
What's with the
So
doctors
it's
and
really
their
important to have
handwriting?
input.
Why did
Well, and
doctors
the other
handwriting?
funny
Why is
part
it
is
like chicken
often
scratch?
I'm not sure. I just know that sometimes we can read it because we do it so often that we know what their T's look like or their I's. And most people look at us like, how can you read this? And then it's just because we understand the name of the drug and how the dose goes that, and then what the patient's telling us that we can actually decipher some of it. But in that case in point is if we do misread it, there could be an error. So
Yeah.
again, why it's important for the patient to know what the doctor was writing before they left.
I'm just picturing you guys with like a magnifying glass looking at the prescription and being like, which doctor is this? That's hilarious. Oh my gosh. So funny. So why don't we talk a little bit then about maybe misunderstanding medical instructions? Do you want to touch on that a little bit?
Sure. I think there's again some key points in this error that can happen. And on the patient side of it, really, if you don't understand what you're being told, and I'm going to say, as a pharmacist, when I was dealing with some things with my son and I was speaking to the surgeon, I mean, he was talking about things that I didn't really understand. And I'm in healthcare.
Right.
And he's talking a
Oh
different language.
wow.
right? Because it is a different language. Each specialty is almost a different language.
Hmm.
So when we talk to a healthcare professional, I always say, if you don't understand something, just say that. Just say, you know what? I just can you just tell me in mom's language? Can you tell me in my language? I'm not understanding that. And I had a situation where one of the pharmacists was explaining something and she was a student and she said, "Well, that can cause general malaise." And I looked at her and I said, "Okay, think about this. When you were in your first year of pharmacy on your very first day, did you know what general malaise meant?"
I was just gonna
And
say, what is
right.
that?
And of course, it's no, but we get wrapped around all the knowledge we have that we
Hmm.
forget when we're speaking that some of those terms are not everyday speaking terms. So, general
Hmm.
malaise just means you're going to feel unwell. So, just say you're going
Oh.
to feel unwell. You know, it's it's something like where the doctors aren't intentionally speaking to you so that you don't understand them. It's or the pharmacist. It's just we are wrapped in our healthcare world. That's how we speak every day. So when we're trying to communicate with you, if you don't understand, just simply say, "Can you just pause for a minute? I don't quite understand what you're trying to explain to me." Instead of just saying, "Oh, okay, sure, sure, no problem," and walking away and then not knowing the instructions properly, because that's going to create the error. That's going to create the problem for you. So, where your responsibility comes into place is really understanding what they're trying to explain to you. And if you don't know, ask. That's how you're going to prevent that miscommunication on understanding what I call the medical knowledge words, right? There's a million of them. So that's where the language is literally after you go to school, you understand some of those words. Before that, we didn't know them either. Before I went into pharmacy school, I didn't know absorption. I didn't know all of these words that had to do with bioavailability. What are those words? I didn't know them before, but after pharmacy school, you learn them. Same thing with a pediatrician, a neurologist. That's their language. So it's difficult. And that's where I think a lot of us do have an hesitation to act like we don't know. But of course you wouldn't know. So leave that out of the thought process. Just say, I'm not, you got to dumb it down for me. You got to speak on my
Hmm.
level. There is nothing wrong with saying that. In fact, it snaps into the healthcare professional's mind to be like, oh, yeah, right. Got to talk like I'm talking to my, you know, 9-year-old son. That's ultimately how I've always told my pharmacy students, you speak to someone like they've never went to pharmacy school. You have to do
Hmm.
that. And it's really important to ask that question.
I tell people, like, when professionals, experts are talking to me and I don't understand, I say, talk to me like I'm three, please, because I don't understand a word you're saying. Right? I've always said that. But I do know that when I was younger and not so confident and sure of myself, that when a pharmacist or a doctor was talking to me in these high level terms, it made me almost feel like I wasn't intelligent. You know what I mean? So I was afraid to counter and ask because I'm thinking, should I know this stuff? Right? They're talking to me like I know this stuff. So should I know this stuff? So yeah, it really, you're right. You have to just ask because as a professional and expert who does it every day, that's their regular terminology. That's how everyone speaks, right? So yeah, talk to me like I'm three needs to be the status quo.
Yeah, and I think that's again what happens in what I said in the beginning is fast paced, right? You have to remember that
Hmm.
it's like one after another, after another, after another, and we're in our groove and we're just, this medication has helped to treat, hyperthyroidism and it's gonna, it's like, well, what the heck is hyperthyroidism? Like, explain that to me. What does that even mean? What is it going to mean to me in my life? What is it going to mean to my children's life? What does that mean? How does that look in my life? And like, of course, everybody's situation is different. So, sure, me as a pharmacist, I can understand certain terms better than someone else, a physician to another physician. But the thing that happens to everyone is when you're in a healthcare situation, you're under stress and you don't, like I said, hear, you don't see necessarily everything because you are consumed with the stress. of seeing someone who you love is sick and you need you need care. You're consumed with that. So even if you do have all the knowledge in the world, you're not necessarily going to hear everything. So repeat. I think I understand, but I'm not sure. Even if you understand what they said, repeat it. Paraphrasing is the number one way to make sure there isn't an error. Write it down, paraphrase it, and just say, I just want to make sure I've got this. I'm supposed to take one tablet 3 times a day with food, but avoid dairy products. Is that correct? One sentence. Just paraphrase it so you know you understand. And then that way you walk away with that sense of confidence. I got it. What you said is very true. I sometimes, when I hand out medication and I explain it, and then I think to myself, did they get it? Did they really get it? And then I'm like, can you explain to me then? I just want to make sure I didn't miss any key parts. Can you explain to me what I just said? Because I'm sorry, my brain is, running a marathon right now and is just everywhere. Can you just re-explain it to me? That sometimes was one of my key ways to make sure that the patients understood what I was explaining. And I think it's really important as well. You listen, you ask if you don't know, and you re-paraphrase. And that is in every single healthcare interaction. It doesn't matter if it's a pharmacist, a dentist, a surgeon, a neurologist, a specialist, a nurse, doesn't matter. If you ask for the clear understanding and paraphrase what they've said, now you've got clear communication.
Beautiful parroting, just repeating for understanding. It just makes you feel so secure in what you understand. So that's so smart. So let's touch on the lack of follow-ups. So let's speak on that a little bit.
So when you look at following up, I mean, we talk about technology, and I think this is great. Labs, X-rays, MRIs, any type of diagnostic test that you get. A lot of times, doctors' offices are very busy. You might wait on hold for an hour to make an appointment, let alone trying to call in to see what your lab values were. It doesn't exist. What you're told 9 out of 10 times is, we'll call you if there's a problem.
Yes, I was just thinking that. I was
Yeah,
just thinking that.
right. And
And
that's
then I'm my phone, I don't want it to ring. So,
and
but I'm
that's an
still
issue.
wondering, but I'm still
You're
wondering.
wondering, right? You do. You walk away thinking, well, I never heard anything. I guess that's a good thing. But here's what we do know is sometimes those reports get missed. The reports come back, doctor doesn't get a chance necessary to look at it, or there's a delay. And this is why with technology, you sometimes want to just find out when that lab result comes out. Is there an app that result goes into? There are many healthcare organizations that when you access diagnostic testing, that they will be able to provide you as the patient that information. And it's complicated. Again, it's going to be in language you don't understand, but you have a result and you will see, it might say high or low or abnormal. Those are the things then that you just want to look for. And then that should alert you to say, you know what, I think I want to just go and book an appointment and talk to the doctor about this. I wouldn't panic about it because when you're reading it, you might not understand 100% what it's saying, but at least you have the result. And I think that's critical, getting the result. If you don't hear anything and you're worried about it, you know what? Book the appointment before you leave the office. So you don't have to wait on hold for an hour. But when you're there, you're going to get labs done. Book a follow-up appointment. Ask, how long will it take before I get the results? Doctor will know that. They'll say, oh, probably 2, 3 weeks. Book your appointment for 2 or 3 weeks later. Go in to see the doctor with your only concern being, I just wanted to follow up on my labs, on the diagnostics, and then see how you're feeling. I still don't feel well, or you know what, I think that's resolved, but I just wanted to understand what were my labs so that you keep yourself in the loop with this information and you can document it so you have it for next time as well. And you can compare things. If you're doing a yearly and you're getting your cholesterol levels checked, you get the results. You can keep that information, check it the year later, and compare and say, oh, I'm doing better. I did cut out a bunch of these things and these foods and these habits, and I've exercised more, and now I can see my progress. So that's as well, decreasing that error and increasing optimal health.
And I think that has a lot to do with similar. topic to missed appointments, right? Do you want to touch on that? And then I'll get you to do like a summary of the common healthcare errors and missteps before we go for today, because we're almost running out of time.
Sure. So when we talk about the communication piece, it's really, really important to know that when you are going to book an appointment and you have scheduled appointments, you should have that listed. What are in my age group, what are the things that I should be prevention screening and appointments for those? Don't miss those. And moms, women, you know what we do? We put those things on the back burner because everybody else gets looked after and we don't. You've got to make sure you schedule those for yourself. It's, put the mask on first and then look after the family. So do your scheduled screenings, book those appointments. Don't miss an appointment as your annual checkup and then just say, oh, I'll get that done, in a few months. And then before you know it, 6 months have gone by. Put those things in your schedule. And what I like to do as a little reminder is I do it on my birthday because every year I'm going to have a birthday. And so I book. Always take the day off work, and maybe not everyone has that luxury, but I take the day off work and I make it my health day. And I book my appointment with my doctor to do my annual screenings. I will book my child to do the same. And I go in and we do our annuals on my birthday because then I know it's done for the year. And then I'll go do all my labs and do all of that stuff and it's finished. And that's how I kind of keep my schedule. But pick a day, pick your one day of the year that you're doing your prevention screenings and you will go do your annual, get all of those things done, and then it's done for the year. Now, when you have an appointment where the doctor says, I want to see you in 6 weeks, keep it. Try your best to not miss it because, we'll sometimes say, well, that's just the doctor who wants to bill more. You know what? I know it's tedious to have to leave work and go, but the result of not going could potentially mean something's not followed up that should be. And then that leads to an error. And that means that you didn't get treated when you should have. So, what I say is don't miss your appointments. If the doctor is recommending that you go back in 6 weeks, go back in 6 weeks. Book it before you leave. And then keep that on your calendar, being like, this is your health, most important priority. I have to do this. Book it where you know you're not doing child drop off or pickup. If you book it and something comes up, try and get a babysitter, or you know what? Bring the child. I had to do I brought my son with me to doctor's appointments. I just sat him down and I gave him a fidget toy and I said, you're playing here. I am doing my doctor's appointment because it's the priority. And that's where we see things fall into the cracks where if only this would have been caught earlier. You don't want to do that if only. Stick to those things.
Oh my gosh, Lydia, I have to book a follow-up appointment with my doctor. I haven't done a checkup in years. I'm
Yeah,
seriously going to do that as soon as we're done this episode.
I'm glad to hear that.
Oh my gosh. Can you tell everybody where they can find you, what your services are, and your website?
Sure. So it's my name, www.lidiamolinara.com. And on Instagram, my reel is at Mom's Healthcare Navigator. So follow me there. I even have more tips there too.
Beautiful. We did get through a lot of common healthcare errors and missteps today, but there is so many more. And people should go to your Instagram to check that out or your website because there's so much valuable information right in front of me that we didn't get to touch on today. So
Mhm. Thank you.
amazing. Do you want to leave the audience with one really powerful tip before we go for the day?
We have the power to make sure that errors don't happen to us. It's in our hands. We can do it.
Beautiful. Thank you so much for joining us today.
Thank you again for allowing me to spread more awareness. I appreciate it.
Yes, and I'm learning so much from you. And I've been in this healthcare system in Canada for 40 years, and listening to you, I'm like, I got to do that. Oh my gosh, I got to do this. So I've gotten so much value out of today's episode. I'm going to spread the word.
Thank you. Appreciate that.
Amazing. And to our listeners, thank you so much for joining, for tuning in. Make sure you tune in for the next episode because we're going to just continue digging deeper into the healthcare system and advocating for our own health, our family's health, and our children's health. Until next time, I'm Lisa Urbanski with The Advisor.